So, the topic I chose for my research article is educational needs of U.S. emergency nurses related to forensic nursing processes. I kind of chose this article because I think it's really important for not just us as nurses to have a broader knowledge of different things, but I've always been interested in forensic sciences, so I thought this was a pretty cool article to read. Um, the goals and purpose of this article is to figure out the gaps in knowledge with emergency room nurses when it comes to forensic nursing processes. So they're just seeing how much more education they need and then developing resources for them to use to expand their knowledge. A brief background and kind of what we already know is that violent related injuries in patients require a bigger trajectory of care. So you're going to do your basic nursing care, treating the whole body, holistically treating it, and then eventually there's probably going to be an investigation involving the police and any kind of legalities. So it is important for the nurse to get that information from the patient and give it to them, so that way emotionally the patient is taken care of, and keeping them safe and letting them know that they're safe. What is necessary or important to conduct the current research? So it's important that we have nurses to do the research. This article specifically does emergency room nurses, so obviously emergency nurses are what is required to conduct the research. And then depending on what type of research they're doing and how they're going to get that information out there is also important. So if it's electronic, you need to make sure that people have phones and computers to have access to that. Next, so the discussion of methods and what was used. So the research design that was conducted using quantitative exploratories and surveys to ER nurses. The study subjects, obviously emergency room nurses. Procedures used to obtain the data, so they used the Emergency Nurse Association and sent out emails to them to answer, so like a questionnaire. Materials and measurement devices for the data collection. It was just electronic emails of questionnaires, and the nurses would type their answers and send it back, and they read the answers, and that's kind of how they obtained their data. So a step-by-step description, there's a lot of numbers involved in this, but there were 43,775 emails that were sent to the Emergency Nurse Association. Out of that group that they sent it to, only 2,493 nurses actually opened the email and opened the survey, and then only 1,824 nurses completed the survey and sent it back in. So the total response rate was 4%, and then a 73% response rate from those who opened the email. So meaning they opened it and took the survey, or they opened it and didn't take the survey. Procedures used for the data analysis, like our research results and findings. So basically from seeing how many nurses actually opened the email and did the survey and answered all the questions, they came to the conclusion that education was needed a lot. The gap of knowledge in the forensic nursing process was really big. And their conclusion was that we just needed more resources for the nurses. So whether that's the online modules that you take for the hospital that you'll usually take every year, so creating more of those, or maybe creating more in-depth modules for nurses to take. And obviously nurses and CNAs and physical therapists, obviously everybody would be taking that, but for nurses it would be more focused on that and what to do and the steps to do. So my personal thoughts. So, the importance and implications of the results for the nursing practice. I mean, just from reading the article, education is very much needed. Because if a nurse isn't properly educated on anything, that could put the patient in danger, and obviously that's not what we want to do. So when it comes to forensic nursing processes, this is usually involving, like I said, assault, abuse for adults or kids, and then also pregnant women as well. So not only were they hurt physically and emotionally, the person who did that to the patient is still out there and could have more people, and it's just the patient's more in danger than other patients like that would normally be in the hospital. um, some of the weaknesses that I saw in the article, and it's asking if there were any potential biases. I didn't see any biases that could have affected the results. It was pretty straightforward and pretty like basic questions like what's your knowledge and stuff like that. But a weakness that I saw was they were only using email to do the surveys. There are a plethora of plenty of different ways to get this information out there. There's interviews, there's maybe just a short questionnaire, stuff like that. But also, if a patient comes in and it's requiring the forensic nursing process, you're going to have a lot of nurses taking care of them, so day shift and night shift. But eventually that patient will move from the ER to ICU or medical surgical or labor and delivery or pediatrics or wherever. So not only do you have all of those specialties taking care of them, but you're having the day and night nurses also taking care of them. So this research was just about emergency room nurses, and I feel like adding in those other specialties could have helped as well, and adding in that like more research on them and how much education is needed from them as well. And again, just making sure they're involved with the patient's care.